But a new study is ranking Utah hospitals as the worst in the nation for COVID-19 preparedness. Tonight, the Utah Hospital Association is responding to that study, saying it's inaccurate. ABC4's Brittany Johnson joining us live in studio with both sides of the story. Brittany.
That's right, Emily. The study is based off data from 2018. Now, I sent it to Greg Bell, the CEO of the Hospital Association. He says the study is flawed and did not take important measures into account. I also spoke with the author of the study. What he has to say is quite surprising.
When it comes to states being prepared to handle both the capacity of the healthcare system and the COVID-19 outbreak, Utah gets an F, at least according to this study. Quote Wizard compared the number of hospital beds to the number of physicians per 1,000 people. It found Utah had 2.11 physicians per 1,000 people and 1.82 beds per 1,000 people, putting Utah in the #1 spot, worst in the nation for hospital preparedness. Greg Bell, president and CEO of the Hospital Association, says the study is inaccurate. It doesn't consider Utah's lower case count, infection, and hospital rate compared to other states, among other things, and that Utah has fewer deaths.
They didn't take into account how many ICU beds we have, how many ventilators we have. They didn't account for the surge capacity we have. In other words, the auxiliary beds that both we as hospitals and the state of Utah have reserved for a real surge if we had a huge run on hospital beds.
In retrospect, Utah being least prepared on our analysis a few months ago, might not have been the absolute truth.
Adam Johnson is a research analyst for Quote Wizard. He says after speaking with Greg Bell about the data, he realized Utah hospitals are better equipped than he originally reported. One reason, Utah hospitals have certain beds that can be turned into ICU beds and other factors. But Johnson also adds his data is still valid.
It's really an allocation of resources. While there may not be as many hospital beds per person as in other states or physicians per person, it's the allocation of those resources that's it's a key factor.
Bell says Utah is prepared and ready to handle an influx in cases, but adds hospitals will be overwhelmed in a month if the state's case counts aren't reduced.
We've had times where a hospital will get above the critical point of 85% full. Because once you're 80 to 85% full, that just means you have a few beds left, not just for COVID, but for heart attacks, car accidents, strokes, that sort of thing.
All right, Brittany, well, this causes the question, when it comes to coronavirus case numbers, what is the Utah Hospital Association really monitoring to ensure that our hospitals don't reach capacity?
Great question. The main thing is the rate of speed. In other words, the increase of cases versus the number of beds that they have, and especially the number of ICU beds that are available. So moving forward, Emily, we do need to keep a close eye on the daily rate increase of COVID cases. Back to you.
All right, thank you.